thank you all for having me here today in this incredible room. This is only a Washington room, and it takes 20 minutes to get to the stage. So, I am so delighted to have you, and so grateful to so many of the partners who are here, especially the National Coalition for Infant Health and the Institute for Patient Access, but so many more. Your voices make a big difference in what we do in Congress, and I know that often, and Congress has a well-deserved reputation of late for being dysfunctional and not getting things done, but your voices really matter. And the story of the work that you're doing, that of your patients, it really does make a difference. So know that what you're doing and coming to DC is very impactful, and we're very grateful for your partnership and your help and your common goals that you have for families, because we know one of the best ways to improve our society and our economy is to help families and children overcome health barriers. And so whether it's working to guarantee health care for every child, or getting mothers the holistic care that they need after birth, or working to ensure that all babies have access to the nutrition they need, regardless of their parents' financial ability or where they live, our work begins long before a child ever gets to a classroom. And I consider it my job to work with you and make sure that your expertise, your advocacy is being heard by my colleagues, and that our care providers have the resources that they need to help our nation's infants thrive. So I want to update you on a topic that I'm sure is familiar to you, but that we've been working on, about the exploding rise of neonatal abstinence syndrome, NAS. And as well as some of the steps that we are trying to take in Washington to help. So it was just about a year ago that I was contacted by a social worker in one of my communities of Malden, Massachusetts, with the story of an infant who was born dependent on opiates and whose seizures during withdrawal were so severe that it actually detached one of his retinas. And what I found out was that this heartbreaking scene is playing out in almost every congressional district across the country. And that it is one of the chief, NAS is one of the chief causes for the significant surge of babies in neonatal intensive care units across the country. And if there is a takeaway from this opiate crisis and addiction epidemic, it's that it really doesn't have any limits. It doesn't care if you're in a red state or a blue state, doesn't care what your levels of educational attainment are, doesn't care what the balance in your checking account is. And in battling opiate abuse, we have to make sure that we are taking a holistic approach. But for the moment, I'm using NAS as a way to not only bring relief and help to healthcare providers, to children, to families, but also to educate and raise the opiate crisis in general to Congress and to the public, and get people thinking about what it is. And using these youngest victims is a way to create knowledge and empathy about the situation that is happening in our neighborhoods. Because the same pain that adults describe as the worst pain they've experienced, the pain of withdrawal, that is what these very, very young babies are going through. And over the last decade, we've seen it explode. NAS rates have risen fivefold, and in states like my home state in Massachusetts, we're seeing babies being born dependent on opiates at a rate 3 times the national average. And in my small hospital in my hometown in Melrose, where we're sort of known for Victorian architecture, easy access to Boston, and, decent schools, we are seeing in our community hospital a rate that is, almost coming on 5% of our births, which, a lot of people in, my friends would like to say, well, that must be people coming in from other communities, but it's not. And you know that from your experience, but this is what we are trying to draw attention and get that information out to people. And we've seen lots of efforts in the treatment and on the criminal justice side, but little has been done to focus on NAS. And we sought the advice of researchers in our district, as well as doctors, to identify deficiencies in our healthcare system and how we could help. And with the help of our partners, we've also discovered that not only is there a human toll, but there's also a monetary cost. 80% of these births are covered by Medicaid, and they tend to be 5 times more expensive than a typical birth. States are also really vary in how they address the problem and in how much data they are collecting. And there's often incomplete information or none at all available. This all hampers hospitals' ability to identify the scope of the problem, apply solutions effectively, leaving many hospitals and care providers on their own when it comes to piecing together the best methods to diagnose and treat NAS. So with your help, we have put together the Protecting Our Infants Act, which is the first federal legislation to look specifically at addressing the rise of NAS births. And I think Dr. Goldstein mentioned that I am a member of the Progressive Caucus, and of course I come from the very blue state of Massachusetts, and I'm one of the most junior members of the minority party. So taking all that, not the most likely person to lead a bipartisan charge, but that is exactly what has happened, because I have found that this issue, when I go across the aisle and say we have a terrible bond, your state and my state are experiencing epidemic proportions around opiate abuse. And we have to do something, and this is one small way we can start to address this problem. So we are delighted that we have over 30 Republican co-sponsors in the House, that Majority Leader Mitch McConnell has also filed this legislation in the Senate and is our partner on it. And I think it is a good example of how your work can really help. We may disagree on 98% of political topics, but when it comes to helping families in our district, if we can focus on them and put them first, we can find those areas of commonality that can help us not only do better by people in our district, give you the resources that you need, but also help make Congress, help knit Congress back together again and get us to be a more functional body. So with the broad support in both chambers, we are very hopeful that we're going to get this bill passed. And there are 2 critical benefits that you should know about. The bill requires the Department of Health and Human Services to develop recommendations to prevent and treat prenatal opioid abuse and NAS, review its programming to develop a coordinated strategy to address this crisis, and provide assistance to states in the collection of public health data so they can respond as well. This bill will also save us money. It will help increase the efficiency in our hospitals by identifying the best practices in diagnosis and treatment, and by coordinating our national health agencies to make sure that states have the information that they need. This is not controversial, partisan, or political, but it is good policy. And I am hopeful that we're going to be able to get behind this and pass it. Today, when I leave here, I'll be going to the hearing on this bill on energy and commerce. And we think that's a very good sign that we can get this to the House floor soon. And I just am very grateful for so many of the neonatologists who have helped and your input. And I want to say to you that the door of my office is open to you. We are only reflecting the work and information that we get from you and trying to help put this forward. So we would love to hear from you, work with you on how we can not only get this legislation passed, but the other things that we can do together to help promote good health for our premature infants and for all the babies that are being born. So I'm very grateful for having me here today, for your partnership and for the work that you do in your communities. It's a benefit to all of us.